Hey guys, I'm Dr. Jeremy.
Dr. David here.
And today we're going to talk about carpal tunnel syndrome. So for those that don't know, and I'm sure most people would have heard of what carpal tunnel is, it's when the median nerve gets compressed within the carpal bones, which are, you've got 8 little bones that are in the wrist, and the median nerve can get compressed between those bones. And what happens is when the median nerve gets irritated, you're going to have sometimes pins and needles, tingling, sometimes pain into the hand. And the other thing that you can have is loss of grip strength. And it's fairly common, carpal tunnel syndrome.
100%. So when we're talking about some risk factors, who are more susceptible and who are more likely to get these sort of conditions, it's actually quite debilitating.
Absolutely.
So people who are overweight, obese, people who uses their wrist a lot, for example, some sort of drilling and things like that, a bit of shock through the wrist. Also, we're talking about pregnancy. We see that quite often as well. And as well as rheumatoid inflammation. So when we have some inflammations in our body, we're more acceptable. As well as we're seeing more women getting this carpal tunnel syndrome compared to men.
Absolutely.
Yes.
And we know that about 5% of people, 5% of all people will get carpal tunnel syndrome at some point in their life, which is quite a lot. So there's a couple of options of what to do with carpal tunnel syndrome, and they can range from the invasive, like surgery, to more conventional care, like chiropractic care, some physiotherapy, massage, maybe
ultrasound, sometimes some
cortisone
injection, sometimes.
So what we want to show you here today, guys, there was a study done with chiropractic care and carpal tunnel syndrome.
Yes.
And 2019 study, won't go into all the details. We can always have better studies when we talk about studies, but it was an interesting study that showed that carpal tunnel syndrome had favourable outcomes with chiropractic care. So if you do know anyone that has carpal tunnel syndrome, the message today really that we want to let you guys know is that we don't want to do really invasive things first. We want to all try conservative care first, and that can include a course of chiropractic care to free the nerve up, not only here, but just like a garden hose. If it's pinched anywhere along the line, it's going to be worse at the end. So we want to free the nerve up from where the whole nerve runs.
Absolutely.
And that's something we can look at and help you guys manage with some chiropractic care. So if you know anyone with carpal tunnel syndrome, send them in, guys, before they go and get more invasive care done straight away.
All right. I think that's all.
Nothing to add to that?
Yes.
Excellent, guys. Have a great weekend.
Have a great weekend.